I'm just going to give a little update about my health. One day I felt a sensation around here, and so I put my hand over here and I noticed I had a lymph node. I used to get lymph nodes a lot as a child, and I didn't really think anything of it. I thought maybe it was bacterial, viral, something. Or, it was that it was normal to have. I saw my lung transplant doctor a couple days later, and I told her about the lymph node, and she said, you need to have that biopsied because it could be lymphoma. I was sent to an ENT, and the ENT said, well, we need to do an ultrasound before we do anything else because we have to make sure that it's a lymph node and not a salivary gland. So I had the ultrasound done, and then I came back and he said, okay, well, it shows that you have a lymph node, and it doesn't really say much else. I think it was supposed to say something about fatty tissue or something, and it really didn't have much to say other than it was a parotid lymph node. So the ENT sent me for a biopsy, and the biopsy was pretty terrible. So the doctor there he tried to take a sample straight from the lymph node a couple times, but he couldn't get it. So then he decided to, I guess, go in lower, like the lymph node is here, and he went like here. And he was taking a needle and going in and out, in and out, in and out, in and out. And that was just one sample. And he did that 4 different times. And it was kind of violating. It really was a terrible experience. Although it wasn't really pain other than he kept hitting a nerve and my ear hurt terribly from that in different places. It wasn't pain. I can't really explain what it was, but it was a really terrible experience, and I almost felt like crying afterwards. But I didn't really let myself cry, which I should have. So I went back to the ENT, and the results showed that it was category 3 atypical cells, and it was showing that it was salivary tissue. So the ENT said, well, it's good news that it's not cancer, but it's not benign either. So we have a couple options. One of the options was to monitor it over a period of time with repeated ultrasounds to see if it got bigger. And another option was to see his colleague, who was like the head surgeon. So I was like, yes, I will take the second opinion. So when we went to see the surgeon, I explained how I had a lymph node, and we saw the ENT, but there was salivary tissue. And I also told him that I had a small cancer, a squamous cell cancer, skin cancer removed from the top of that ear recently. So I was like a little nervous. Could this cancer somehow have spread to my lymph node? But that would be a little strange because it did have clear borders when it was taken out through Mohs surgery, but I mean, anything's possible. It could have migrated. So I told the doctor, and he was like, well, do you mind if I do a biopsy myself right now and see if I could get a biopsy of the lymph node? And I was like, yeah, please do, because I want to make sure it's not actually cancer, and I'm not really sure what the other doctor had biopsied. So he was able to directly go into the lymph node and take a sample. He told me that if this was indeed a lymph node and it was benign, it could stay. If it was a salivary gland, it needed to come out. So he wanted me to do an MRI, which I haven't done yet because unfortunately I couldn't get it scheduled until the day before Thanksgiving. So it was a bit of time that is passing before I get the MRI. But I did end up getting the results through my chart of what he biopsied, and it came back as salivary tissue, but it also came back benign, which was a big relief. So I still need to see the doctor after the MRI. They told me I couldn't schedule the appointment until after the MRI, so I still don't have that appointment yet. I'm hoping that if he does want to take the salivary gland out, that I will be put to sleep or get some kind of anti-anxiety medications because, like I said, the other procedure was a pretty terrible experience.